And I would like to introduce Sara Rupenovic. She's the registered nurse who has worked in aged care for the past 15 years. She joined Tabulum and Templar Homes for the Aged in 2017 as a clinical care coordinator, and she moved to the Director of Care General Manager for residential role in 2018, and she's been there for the past 8 years, and she's very generously offered to give us a bit of a demonstration of how they've implemented My Health Record at their residential aged care home. Thank you, Sara.
Thanks, Barb. Thanks, Sara. So just going to go through the use of My Health Record at TTHA in the aged care setting and how we set it all up. Thanks, Sara. Next slide. So we originally had to get access, which we started in May of 2023. It was through the PRODA. There is a PRODA digital access guide that everyone can have access to. We originally had to get our HPIO and the NASH certificate through the PRODA HPAS. We had to get one of the directors to authorise us to apply for it. And once we put in the application, within a couple of weeks, we did have approval for access to those. Next, Tara. We then had to set up the configuration between our clinical and care management software and My Health Records, because we had access to My Health Record through the PRODA service, but to be able to access and upload, we had to integrate it with our software, which is Telstra Health iCare. We just consulted with our IT through Telstra Health and provided them with the two certificates, the HPIO and the NASH certificate, and they set us up. We then had to select and give individual staff access to My Health Records. So only registered nurses with a HPII that can access that through AHPRA can have access to My Health Records, and we needed to have an organisation maintenance officer, which was myself and one of the clinical care staff who could provide the registered nurses access to that to make sure that it was eligible staff accessing it. Thanks, Sarah. That's what it looks like through our system. Sorry, I've just covered our resident with a smiley face for privacy, but it's pretty much a tab that gives us access through the resident profile, which makes it very easy to access the information we need through the integrated system. Thanks, Tara. So we now have access to a lot of information like discharge summaries, pathology, diagnostics, immunisation records, residents' medication, at the touch of a button. It is very time saving because we don't have to be on the phone to the hospital when they forgot to send a discharge summary back with the resident. We can pretty much go to the My Health Records and access it. Residents who we need to check their INRs, it's easier to just go there and keep the record there. Residents' allergy status can easily be accessed through there, and you can actually track back to where the allergy was initially recorded as well. Thanks, Tara. And the last step that we're currently working on is uploading the residents' advanced care plans through My Health Record to give everyone access to, and that's also through the Telstra Health software. It's just pretty much the same way that we upload all our documents. We just have to tick a box to say that that's an advanced care plan and we have authorization for it to go to My Health Record. And it's as simple as that.